Shaunda Luken, Senior Sales Manager at Better at Home and Mederi Caretenders, explains the special care modalities they offer their diabetic patients.
So many patients really don't understand what to eat having diabetes. Their physicians don't really have the time in the office to go through a full meal plan, or if they do, they really don't understand it. They're embarrassed that they don't understand, and they don't think to ask those questions. So when we go in, especially to a newly diagnosed diabetic, we're going through their cupboards, we're making out meal plans for them, we're explaining to them how to substitute. If you have so many carbs today, then you can't have another food because carbs turns to sugar. If they're not understanding why they can't keep their sugar down, we're going to go through, what did you eat today? Let's write it down. Let's see what you're actually doing so that we can get that under control. Oftentimes they're afraid of doing the injections. We can go out and educate them on how to do the injections. If they don't want to do it themselves, educate a caregiver to do that as well. Education. Medicare covers the cost of education because it's going to keep their patients out of the hospital. Education is a huge piece of what Better at Home Mederi Caretenders do when we're going to these patients' home because they don't understand. And it's our job to make sure that they understand how to care for themselves. They now have a disease that it potentially could be life-threatening. It could cause them to lose limbs or blindness. So it's very important that they understand what they need to eat on a daily basis and how to keep that under control. At the end of the day, we let the patient's needs dictate the level of care, not what the diagnosis is. Because they may have been in the hospital for syncope, we get out to the home and they've got diabetes, they are in heart failure, they've just had a knee replacement and they're not doing well in the walking, they've got vestibular issues. You have to address all of that. You can't just go and address a wound care case from surgery when they've got all these other issues going on. We would not be doing our job. And whether or not we've already turned that into Medicare and said this is what we're going to do, we're going to need 10 visits, you actually have 60 visits that you can actually go in and do. It's all about the patient.
Better at Home and Mederi Caretenders are sponsoring a senior health and wellness fair on November 21st at the American Legion in Lady Lake from 10 a.m. to 1 p.m. Stop by and say hello and learn more about all the services they have to offer. Part of the Almost Family network of home health providers, you'll find contact information for Better at Home and Mederi Caretenders when you click on the Diabetic Home Care story icon link on our homepage at yourhometownhealth.com.